The topic of study we have chosen today falls under the umbrella of asthma. And as we know, asthma is a disease that affects many people in both the hospital and community settings. As it stands, the mainstay therapy of asthma includes the use of various types of inhalers, and the one that you use depends on the severity of your asthma. This study focused on the treatment of mild asthma, where mild asthma in those over 6 years old is typically treated with a maintenance dose of inhaled corticosteroids, as well as a SABA, such as Ventolin as needed. This study put that typical regime into question, and was one of 3 studies that prompted the change for the 2019 GINA guidelines to include the use of Symbicort, where Symbicort would be used as an as-needed monotherapy in those with mild asthma.
This study was conducted on a sample of 3,849 patients aged 12 years or older who had received a clinical diagnosis of asthma at least 6 months prior. It was required that these patients were classified as needing step 2 treatment according to the GINA guideline. These patients were separated into 3 groups, the intervention group being Symbicort on an as-needed basis, and 2 comparator groups, one being a twice-daily placebo with terbutaline as needed, or twice-daily budesonide with terbutaline as needed. The 2 major outcomes that were studied were 1, electronically recorded number of weeks with well-controlled asthma, and 2, number of severe exacerbations. The Symbicort group reported a 34.4 mean percentage of well-controlled weeks, whereas the terbutaline group demonstrated 31.1%. However, budesonide maintenance therapy group reported 44.4% of weeks with well-controlled asthma. On the other hand, the annual rate of severe exacerbations was 20% with terbutaline, 9% with budesonide, and 7% with Symbicort. Given these results, budesonide maintenance therapy appears to be the best option for optimizing the control of asthma, which was the primary outcome measured. However, Symbicort may be the best option for the secondary outcome, which is reducing the number of severe exacerbations that a patient would experience.
Yeah, so just some appraisal points for the study itself. So it was done on using a parallel RCT as its structure, which we think is the best one for the questions being asked. The inclusion criteria appear to be reflective of the target population. However, pregnant and breastfeeding women, as well as previous or current smokers, were excluded from this study. Randomization was computer generated, and the groups that it created were very even, both in the demographics and in the lung function and asthma severity. The randomization was protected via double blinding, and the only people that had access to this groups were the people that made the list and those that were packaging and labeling the products. A full set analysis was done with the data, and this means that all patients that were randomized and those that received the investigational product will be included in the analysis, irrespective of their protocol adherence and continued participation in the study. And then according to a chart that was given, only 26 patients were lost to follow-up, which is good, as that's less than 1% of the sample population. There are some concerns though, as volunteer bias may play a role with regards to adherence. So the adherence in all 3 groups was around 79%, which is likely higher than what we can expect in the community practice. There is also a potential for reporting bias, as the manufacturer of Symbicort was the one that did the study and was also in charge of all the analysis.
So a couple thoughts on how it can be applied. So as of right now, it can be seen as another option to the standard maintenance dose steroid therapy. Symbicort may be an especially useful option for those who could struggle with adherence using a maintenance inhaler, and presents as an option to reduce glucocorticoid exposure.
And one last thing to sort of take note of is that Symbicort is currently under special authorization. So future guidelines may impact this, but as of right now, the decision on whether to use Symbicort will likely be cost dependent, assuming that you don't fit the criteria for special authorization.
So kind of like a bottom line summary, there are some concerns with regards to bias in the study, which do affect the validity of the results. However, this has been addressed and has been made clear by the researchers involved in the study. Otherwise, the methods that were used in the study are, in our opinion, very valid for the purposes and the questions that were being asked. The results of the study show that Symbicort used as needed might be valuable for some patients in certain cases, such as decreasing rates of exacerbation. It may be less useful in controlling asthma, as was noted in the results of the weeks with well-controlled asthma. The results seem to have high external validity, as they are generalizable to a broad patient population due to the inclusion criteria. As well, the outcomes measured are clinically important in a patient care setting and therefore can be applied to pharmacy practice.